So I think the goals of the Health Home program are really to provide a person, which we call a care manager. I'll bet that name will evolve over time, but it's really to provide someone who can walk with people throughout their lives, is the way I see it. That really there'll be care management for people who they can then access during times that they're really sick. They can just check in with them when they're feeling well, and that probably will start with people who are very sick with substance use, HIV, serious mental illness, and over time my guess is everybody will have a care manager. And then as they get sick, they'll use them, and as they're not sick, they won't need them as much.
I would say the goal is here to decrease the inappropriate use of the emergency room, decrease inappropriate hospital admissions, really connect patients to primary care doctors and to psychiatrists for those that need it.
Being a leader in the health home movement means being able to put together all of the services necessary to provide really fine care for people who are the most vulnerable in our population. In Brooklyn, we serve a remarkably diverse community, and their needs are also remarkably diverse and can only be served by a number of local community-based organizations that really understand them. The impact on patients is that as they've gotten used to having their care coordinated, they're receiving many more preventive services. They're no longer receiving care of last resort, meaning they're not having to go to the emergency department for every problem, but are attached to a primary care provider who really retains accountability for their care, will reach out using the health home to bring patients back as necessary and coordinate services among all of the multiple providers taking care of patients. So a patient doesn't have to go to one provider, start from scratch, go to another provider and start from scratch again. The information is shared and the patient is part of the process.
I can tell you that care managers have made a terrific impact on the lives of our patients in terms of providing them with housing, getting them to primary care physicians' offices. Something as simple as organizing transportation, whereas before family members maybe had to take a day off or patients missed appointments because they didn't know how they were going to get to an appointment, we've been able to arrange that for them.
I think everybody's been moving to this moment where we've decided people who are that sick and that complicated and that disenfranchised need to be sort of double teamed and given care management so that they can get navigation and help through the system. In looking for IT systems, my goal has always been to find something that can actually pull together what is now seeming to me like too much information. So my worry with IT systems is that we all have electronic records. All the data goes into the cloud. And I think when even in the future, if it's usable and readable and you can really sort of sort through it, it's just too much information. It's information we don't need. I think it's getting the right information at the right time to the right person.
Without GSI Health solution, we wouldn't really have a health home from the standpoint of any ability to really share information among each other, among the providers, to share information with the rest of the state. We'd be like a lot of folks are right now, on paper and just sort of trying to get by through various ad hoc processes. Because our patients are transient, they live throughout this area, Brooklyn, and even receive care throughout New York City, we can't all be in the same room at the same time. So the only way to solve that is to have a technology solution that allows real-time collaboration among all these organizations. When you think of GSI Health, if you're looking for a business-savvy partner, not just a vendor who will deliver something inside of a box, then those are the folks you're looking for.
I think GSI Health is an IT system that will work with clinicians to create something that really works for the clinicians and that really works for them in taking care of patients.
GSI Health has been amazingly flexible in terms of dealing with our needs, bringing to us new technologies and working with us to make sure that they're properly implemented.